Good morning, all of you. I hope I'm audible. Firstly, welcome to Patna. I hope you're having a good time despite the cruel weather. So, my topic for today is an ophthalmologist's toolkit, must have from instruments to books. I don't think I have anything new to say to you today, but this is mostly a recapitulation or a reminder of all the things that we can kind of celebrate day to day that actually make us the ophthalmologists that we are. So, to begin with, we know about the direct ophthalmoscope, which has largely lost favor because of COVID. The retinoscopy, as people say, is both a science and an art. And while there are a number of sources from where we can learn the science of it, the art can only be mastered through a lot of practice. And sadly, a lot of us do not get time during residency, at least I can speak for myself, to master this art. Apart from this, there's the 90-day lens, and fundus details are viewed so intricately with this 90-day lens using a slit lamp. Apart from this, we also know that people use 60-60 lenses and 70-80 lenses. But the best tool for viewing the fundus today, after dilation, is probably the indirect ophthalmoscope, coupled with a 20-day lens. It enables us to see views like this. And this is probably what makes ophthalmology so fascinating as a branch, because a number of times, without even touching the patient, we can see structures like nerves and vessels as they are. This is a privilege that not a lot of branches enjoy. Radiologists do claim that they can see all this, but that's in black and white. You don't see it in color, right? Apart from the 20-day lens, people also use 28 and 30-day lenses. We can also mention the scleral depressor. This is the Shepin's scleral depressor, named after Charles Shepins, the father of the indirect ophthalmoscope. When mentioning the scleral depressor, it also brings us to the pediatric speculum, which is often used for ROP calls. We can also keep distilled water with us. This is very important while viewing the fundus during ROP calls. If we do not have a scleral depressor, however, we can make use of a simple Q-tip for scleral depression, because it's important to view the fundus in entirety, especially the periphery when ROP calls come. Apart from this, we know of these drops. The most common drops that we use are Paracaine, proparacaine actually, but calling it Paracaine has become so common. Apart from this, any broad spectrum antibiotic drop, uh, dilating drops which have tropicamide and phenylephrine, and lubricant drops. Lubricant drops used for moistening strips containing stains, but they're also very important because a number of times people do come up to us and ask for random drops. I think this is something that all of us have gone through. They expect us to be carrying these drops and they want some of these samples. Apart from this, we know that the gonioscope is also very important for viewing the angle. If you're not comfortable with the 2-mirror gonioscope, you can use a 4-mirror gonioscope. Also, the 2-mirror gonioscope mandates the need of a coupling agent. Apart from this, we know of strips, the rose bengal or the lissamine green strips, but the most important is the fluorescein strip, especially for examining cases of chemical injuries, because it enables us to gauge the extent of the actual injury, which has a very important role to play in the management of the injury. Going on to the next one, we can also keep Amsler charts with us, or Ishihara charts. Amsler-Du charts for documentation of the fundus findings, and most importantly, a set of great color pencils to document all these findings. Before I go on to books, I know everyone here has probably gone through all the important books like Kansky and Yanov, and whatever you're comfortable with, even subspecialty books like Krashma, or anything that you're comfortable with in your fields of specialty. Two books that I want to mention which are not really part of the curriculum are Reflections of a Pupil by Dr. Rishi Gupta and Waking Up Blind by Tom Harvin. These are excellent works of non-fiction which are actually a great insight into your life beyond ophthalmology as an ophthalmologist. So these make for great reads whenever you have time. If you're interested, you can definitely go through these. So that pretty much brings me to the end of my talk. Thank you.
That was an excellent talk, Dr. Saranya. Dr. Samiksha, do you have any comments on what else a resident should have?
Yeah, so very nice presentation, and the most important thing other than the drops, you should have a torch with you at every time in your apron. That is very important. And other than that, I think as soon as you join residency, 90D is the most important thing which you should buy at the initial phase. And once you are good at the indirect ophthalmoscope, then 20D is the secondary thing which you should buy. But the first thing is slit lamp examination and 90D, and DO, I think it is becoming obsolete nowadays. That's what I have seen.
Sir, any comments?
Yeah, it was perfect. If you, Samiksa has rightly commented that you must have put torch in your apron all the time. And other things that I would like to say, few instruments also you should have a small instrument kit also. In that you should, speculum and a small forceps should be there always.
I'd like to add it is also sometimes advisable to have a set of your own suturing instruments so that you can try suture practice at the end of every operation theater session or things like that. So it's not expensive to buy 4 instruments and keep them in a pencil box well padded with cotton. And at the end of the OT, you can use the leftover sutures from the day and try your hand at suture practice. So that is something which I'd like to add.
And for the textbook, I would like to add, have an iPad. That is the must-have right now. You have an iPad, you have all the soft copies available, now legally available because all the pharma companies are sponsoring the textbooks. Use an iPad so you have all the reference book handy with you and you don't have to carry a lot of weight around with you. And that way, the iPad also has so many features of underlining, highlighting. So at the end of the 3-year course, you will have all the highlighted course, so you can go through and revise your curriculum and be ready for the exam also. So it's just not for referencing, for preparing for your exam also, you can have that iPad. So.
And definitely, and one more thing that is very important to have, you have to have a presence of mind at every time because you are carrying such expensive equipment with you in your apron pockets or in, you've kept them in the ward, you've kept them in your OPD. So you carry the presence of mind in your toolkit as well.
As
Thank
far
you,
as
Dr. Saranya, and let us. Do you have something to add, sir?
Please.
As far as book is concerned, there are a few books that I would like to recommend. The books written by Dr. Namrata Sharma, Long Cases book, that you should always have with you. If you have any issue, you just go and refer to that. That will help you a lot.